Greetings everyone, my name is Paula Coronel and today I'm going to talk about the trial of transplantation of hcv-infected kidneys into uninfected recipients. First, the definition. The enemy we have to beat in our patients is the hepatitis C virus. It is an RNA virus of 13 to 38 numbers in size with a hydrocodone code. It is a hepativirus of the flavivirus family, which has 7 genotypes. Its transmission is parenteral, therefore it is through transplanted organs, and it has been well documented that it causes acute and chronic hepatitis. Given these risks, transplants from donors with antibodies against HIV has been totally contraindicated in non-infected kidneys. On this clinical trial, the results were excellent in proving that transplantation of HCV genotype 1 infected kidneys into HCV negative recipients followed by the use of directed antiviral agents can provide a high quality, potentially allograft function with a cure of HCV infection. Now we're going to watch a video about this.
In the expander study, we transplanted 10 patients with kidneys from hepatitis C positive deceased donors and treated them simultaneously with antiviral medications for hepatitis C. We had excellent transplant outcomes in these recipients and were able to prevent long-term transmission of hepatitis C from the donor to the recipient. So we were able to successfully treat all 10 recipients and prevent long-term transmission of hepatitis C from the donor to the recipient. They also had excellent outcomes following the transplant in terms of kidney function and recovery. Currently, there are about 1,000 kidneys per year in the United States that are not utilized because the donor is hepatitis C positive and there's no appropriate recipient to place them into. They're otherwise excellent kidneys, so we hope to be able to use them in recipients that already have a long wait for a kidney transplant and treat them with the antivirals that can successfully treat hepatitis C. And so long term, we hope to transplant many more patients with hepatitis C positive kidneys along with treating them for hepatitis C to have both a successful transplant outcome and also prevent transmission of hepatitis C. We hope to take the results of the expander study and apply it to other organ groups as well, especially patients waiting for heart transplants and lung transplants. Both of these populations could benefit from a shorter waiting time. And since there are organs from hepatitis C positive donors, both hearts and lungs that are currently discarded because there isn't an appropriate recipient to put them into, we hope that we can put these kinds of transplants into hepatitis C negative recipients, treat them with the antivirals for hepatitis C, and have successful outcomes.
Surgeons have tools to change this panorama that had been clearly stated by the Hepatitis C Consensus of the American Society of Transplantation. Due to the successful results of this study, this type of transplantation may be considered in the future as a medical practice, and it can also decrease the transmission of the hepatitis C virus. Now we're going to watch another video about the hepatitis C transplant and expand options for the patients.
2 to 7 years wait, usually.
It's a gut-wrenching wait for roughly 1,300 Hoosiers. Douglas Hayes was in that line for 2 years.
I was on stage 3 for several years, and then it went to stage 4, about half the time, and then all of a sudden it was stage 5.
He was battling kidney failure, on dialysis waiting for a healthy organ.
Even dialysis doesn't replace all the things that the kidneys do.
Typically, patients in kidney failure need a transplant soon, or they will likely pass away from complications.
Any new issues since we last saw you?
No.
So that's when Dr. Asif Sharfadin suggested he'd consider taking a Hep C positive kidney, which usually comes from drug users. Only a handful of hospitals do these types of transplants.
If we can use every single organ the wait time becomes shorter for everybody.
Dr. Sharfadine says roughly 500 Hep C positive kidneys are thrown away every year across the country, even though the cure rate is pretty high now, close to 100%.
500 kidneys, it doesn't sound like a big number, but those are 500 lives which are saved right away.
And one of them is now Douglas. He has a new kidney and is now cured of Hep C after taking a pill.
All the risk factors didn't seem to be as bad as what could happen if I didn't get a new kidney.
A whole new life, waiting in line for only 3 weeks after making his decision.
I've got that accomplished, and now I can kind of get on with life.
For Fox 59 News.
Most of the pros are the patients have shorter time waiting to receive a transplant due to the amount of donors. Most kidney transplants live longer. Most patients enjoy better quality of life, no longer in need of dialysis, higher energy levels, work and travel is easier, fewer restrictions on what you can eat and drink. About the cons, it is a major operation, comes with surgical risk like bleeding. The patient will need to take strong medicines to lower the immune system. Through rare, it is possible that the transplanted kidneys doesn't work. Sometimes kidney disease can return into transplanted kidneys. Rarely, serious or even life-threatening complications can occur. The issue applied in Ecuador, we have to know that kidney transplantation has made a significant progress in Ecuador. However, it is still below the goal established by the World Health Organization for the proper management for kidneys with chronic disease. It talking about the results of this article and the high prevalence of hepatitis in Latin America, this could be a new resource to increase the number of patients benefiting from kidney transplantation. Now we're going to watch another video about kidney transplantation.
Every 10 minutes, someone is added to the national waiting list for an organ transplant. Right here in Maryland, there are about 3,500 people waiting for a transplant. So clearly, the need for organs is great. At the University of Maryland Medical Center, our goal is to get as many patients as possible transplanted with life-saving organs. This is why we are now asking patients to consider an organ from a hepatitis C infected donor. Previously, many centers would not use organs from donors with hepatitis C infection because hepatitis C was difficult to treat. Now, new medications have become available that can cure hepatitis C. As a result, transplant centers are now considering the use of hepatitis C positive donor organs. The reason is because the infection can be cured, and choosing an organ from a hepatitis C infected donor can lead to shorter wait times on the transplant list.
Hepatitis C is a viral infection that impacts the liver. Hepatitis C is spread through contaminated blood. Hepatitis C infection used to be very hard to treat, but that is not the case anymore. Now, new medications are available that are typically taken for 8 to 12 weeks and can cure hepatitis C infection. In fact, in many clinical studies, greater than 95% of people who took these new medications were cured of hepatitis C. Recent studies show that if you accept a non-liver organ from a hepatitis C non-viremic donor, you have a less than 1% chance of contracting hepatitis C infection. Hepatitis C virus can be detected within a few days up to a week after transplantation. If hepatitis C virus is detectable in your blood, you will meet with infectious disease doctors and/or liver doctors who specialize in treating hepatitis C infection. They will work with you to determine the best treatment course.
Because this is a newer type of transplant, we are working with insurance companies to be sure the costs of medications to treat hepatitis C are covered. There's always the possibility that the insurance company will not pay for the medications to treat hepatitis C. Even though organs from hepatitis C infected donors were sparingly used in the past, recent studies show that organs transplanted from hepatitis C infected donors into hepatitis C negative recipients work well. These studies also show that hepatitis C infection in the recipient, should it develop, can be cured. If you consent to receiving an organ from a hepatitis C non-viremic donor or a hepatitis C viremic donor, you are placed on an additional UNOS waiting list for that organ. Our goal for you is to have a safe and effective transplant as soon as possible. If you do not want to accept organs from hepatitis C infected donors, That is absolutely fine, and this decision will in no way impact your listing status for an organ at the University of Maryland Medical Center. Choosing an organ from a hepatitis C infected donor can be a good option to get transplanted sooner. We encourage you to talk to your transplant team to see if a hepatitis C infected donor is a good choice for you.
Encourages the type of a new extensive, albeit meticulous, and use of this type of donors led us to the conclusion that HCV is an enemy we have to beat, and it is very likely to be beaten. Thank you.